There's nothing that a parent wouldn't do to grant their child's wish. I do think about Natalie's story and what it would feel like to have a child making that wish and thinking about life like that at such a young age. And I think about my own children, and I start to think about what I would do in order to give them the life that they want. I'm not a medical doctor. I can't treat patients, but what I can do is science. Corneal cystinosis is one of the ocular manifestations of cystinosis. Transparency of the cornea is critical to proper functioning of that tissue so that you can see properly. And in cystinosis, when there's a lack of transport of cystine out of the cells, you see these solid crystals forming. And those solid crystals will lead to some abnormal refraction of light in the cornea. And basically what that means is it causes some discomfort, dryness, photophobia, and other ocular symptoms that make it very difficult for patients on top of the other issues that they're dealing with for cystinosis. We have this vast wealth of knowledge from patients and families and caregivers that we can tap into to help us design the best possible cysteamine delivery system for eyes. There's no blood flow to the cornea, and the cornea isn't typically accessed by a lot of systemic treatments. We focused on a daily eye drop that would give you the full day's course of cysteamine therapy with that single drop, which for corneal cystinosis is a huge improvement in dosing frequency. We also wanted to make sure that we developed something that was very stable at room temperature, so storage would be easier, and something that is non-irritating. We're currently working with the mouse model to make sure that the drug that comes out is active and effective at reducing that crystal density. I would say 2022 and beyond is when we would expect to see clinical trials starting for this. There are faces and names and real people whose real lives are affected by the work that I do or do not do. And for me, that's all the motivation I could ever ask for. CRF has been a main contributing factor in allowing me to persevere and to maintain that same level of motivation in my work. I don't think that there's any amount of research that is too much. I don't think there's any reason to take your foot off the gas pedal until you know for sure that you have reached the finish line. And so until someone tells me to stop, we're going to keep working as if this is as critical a need as it ever was.